Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. These are NCLEX practice questions. Without the way, let's get started.
The nurse is developing a discharge plan about home care with a client who has lymphoma. The nurse should emphasize which of the following? 1. Use analgesics as needed. 2. Take a shower with perfumed shower gel. 3. Wear a mask when outside of the home. 4. Take an antipyretic every morning. The correct answer is 1. Analgesics are used as needed to relieve painful encroachment of enlarged lymph nodes. Perfumed shower gel will increase pruritus. Wearing a mask does not protect the client from infection if pathogens are not spread by airborne droplets. Antipyretics should be used to treat fever symptomatically after infection is ruled out. When assessing the client with Hodgkin's disease, the nurse should observe the client for which of the following findings? 1. Herpes zoster infections. 2. Discolored teeth. 3. Hemorrhage. 4. Hypercellular immunity. The correct answer is 1. Herpes zoster infections are common in clients with Hodgkin's disease. Discoloring of the teeth is not related to Hodgkin's disease, but rather to the ingestion of iron supplements or some antibiotics, such as tetracycline. Mild anemia is common in Hodgkin's disease, but the platelet count is not affected until the tumor has invaded the bone marrow. A cellular immunity defect occurs in Hodgkin's disease in which there is little or no reaction to skin sensitivity tests. This is called anergy. A client with suspected diagnosis of Hodgkin's disease is to have a lymph node biopsy. The nurse should make sure that personnel involved with the procedure do which of the following when obtaining the lymph node biopsy specimen for a histologic examination for this client? 1. Maintain sterile technique. 2. Use a mask, gloves, and a gown when assisting with the procedure. 3. Send a specimen to the laboratory when someone is available to take it. 4. Ensure that all instruments used are placed in a sealed and labeled container. The correct answer is 1. The nurse must ensure that sterile technique is used when a biopsy is obtained because the client is at high risk for infection. In most cases, a lymph node biopsy is sent immediately to the laboratory once it is placed in a specific solution in a closed container. It is not necessary to wear a gown and mask when obtaining the specimen. It is not necessary to use special handling procedures for the instruments used. The nurse's best explanation for why the severely neutropenic client is placed in reverse isolation is that reverse isolation helps prevent the spread of organisms. 1. To the client from sources outside the client's environment. 2. From the client to healthcare personnel, visitors, and other clients. 3. By using special techniques to dispose of contaminated materials. 4. By using special techniques to handle the client's linens and personal items. The correct answer is 1. The primary purpose of reverse isolation is to reduce transmission of organisms to the client from sources outside the client's environment. The nurse is evaluating the client's learning about combination chemotherapy. Which of the following statements by the client about reasons for using combination chemotherapy indicates the need for further explanation? 1. Combination chemotherapy is used to interrupt cell growth cycle at different points. 2. Combination chemotherapy is used to destroy cancer cells and treat side effects simultaneously. 3. Combination chemotherapy is used to decrease resistance. 4. Combination chemotherapy is used to minimize the toxicity from using high doses of a single agent. The correct answer is 2. Combination chemotherapy does not mean two groups of drugs, one to kill the cancer cells and one to treat the adverse effects of the chemotherapy. Combination chemotherapy means that multiple drugs are given to interrupt the cell growth cycle at different points, decrease resistance to a chemotherapy agent, and minimize the toxicity associated with use of a high dose of a single agent. The nurse is planning care with a client with acute leukemia who has mucositis. The nurse should advise the client that after every meal and every 4 hours while awake, the client should use 1. Lemon glycerin swabs. 2. A commercial mouthwash. 3. A saline solution. 4. A commercial toothpaste and brush. The correct answer is 3. Simple rinses with saline or a baking soda and water solution are effective and moisten the oral mucosa. Commercial mouthwashes and lemon glycerin swabs contain glycerin and alcohol, which are drying to mucosa and should be avoided. Brushing after each meal is recommended, but every 4 hours may be too traumatic. During acute leukemia, the neutrophil and platelet counts are often low, and a soft bristle toothbrush, instead of the client's usual brush, should be used to prevent bleeding gums. The client with acute lymphocytic leukemia is at risk for infection. The nurse should 1. Place the client in a private room. 2. Have the client wear a mask. 3. Have staff wear gowns and gloves. 4. Restrict visitors. The correct answer is 1. Clients with all are at risk for infection due to granulocytopenia. The nurse should place the client in a private room. Strict hand washing procedures should be enforced and will be the most effective way to prevent infection. It is not necessary to have the client wear a mask. The client is not contagious, and the staff does not need to wear gloves. The client can have visitors. However, they should be screened for infection and use hand washing procedures. The nurse is assessing a client with chronic myeloid leukemia. The nurse should assess the client for 1. Lymphadenopathy. 2. Hyperplasia of the gum. 3. Bone pain from expansion of marrow. 4. Shortness of breath. The correct answer is 4. Although the clinical manifestations of CML vary, clients usually have confusion and shortness of breath related to decreased capillary perfusion to the brain and lungs. Lymphadenopathy is rare in CML. Hyperplasia of the gum and bone pain are clinical manifestations of AML. A client with acute myeloid leukemia reports overhearing one of the other clients say that AML had a very poor prognosis. The client has understood that the client's physician informed the client that his physician told him that he has a good prognosis. Which is the nurse's best response? 1. You must have misunderstood. Who did you hear that from? 2. AML does have a very poor prognosis for poorly differentiated cells. 3. AML is the most common non-lymphocytic leukemia. 4. Your doctor stated your prognosis based on the differentiation of your cells. The correct answer is 4. The statement, your doctor stated your prognosis based on the differentiation of your cells, addresses the client's situation on an individual basis. The nurse is clarifying that clients have different prognoses, even though they may have the same type of leukemia, because of the cell differentiation. Stating that the client misunderstood is inappropriate for an advocate of the client and serves no useful purpose. The other statements are true, but do not address this client's individual concern. During the induction stage for treatment of leukemia, the nurse should remove which items that the family has brought into the room. 1. A Bible. 2. A picture. 3. A sachet of lavender. 4. A hairbrush. The correct answer is 3. The induction phase of chemotherapy is an aggressive treatment to kill leukemia cells. The client is severely immunocompromised and severely at risk for infection. Flowers, herbs, and plants should be avoided during this time. The client's Bible, pictures, and other personal belongings can be cleaned before being brought into the room to prevent client contact with pathogenic and non-pathogenic organisms. 24 hours after a bone marrow aspiration, the nurse evaluates which of the following as an appropriate client outcome. 1. The client maintains bed rest. 2. There is redness and swelling at the aspiration site. 3. The client requests morphine sulfate for pain. 4. There is no bleeding at the aspiration site. The correct answer is 4. After a bone marrow aspiration, the puncture site should be checked every 10 to 15 minutes for bleeding. For a short period after the procedure, bed rest may be prescribed. Signs of infection, such as redness and swelling, are not anticipated at the aspiration site. A mild analgesic may be prescribed. If the client continues to need the morphine for longer than 24 hours, the nurse should suspect that internal bleeding or increased pressure at the puncture site may be the cause of the pain and should consult a physician. A nurse is obtaining consent for a bone marrow aspiration. What should the nurse do? Select all that apply. 1. Witness the client signing the consent form. 2. Evaluate that the client understands the procedure. 3. Explain the risks of the procedure to the client. 4. Verify that the client is signing consent form of his or her own free will. 5. Determine that the client understands post-procedure care. The correct answers are 1, 2, 4, and 5. The nurse can serve as a witness for consent for procedures. The nurse also ascertains whether the client has an understanding that is consistent with the procedure listed on the form, determines that the client is signing the consent of his or her own free will, and determines that the client understands post-procedure care. The nurse's role does not include explaining the risks of the procedure. That responsibility belongs to the person who is to perform the procedure, such as the physician. The nurse should remind family members who are visiting a client with granulocytopenia to 1. Visit only if they do not have a cold. 2. Wash their hands. 3. Leave the children at home. 4. Avoid kissing the client on the lips. The correct answer is 2. Washing hands before, during, and after care has a significant effect in reducing infections. It is advisable to avoid introducing a cold or children's germs and to avoid kissing on the lips, but the primary prevention technique is hand washing. Which nursing action is important in preventing cross-contamination? 1. Change gloves immediately after use. 2. Stand 2 feet from the client. 3. Speak minimally when in the room. 4. Wear long-sleeved shirts. The correct answer is 1. Bedside rails, called bells, drug administration controls operated by the client, and other surface areas are frequently touched by caregivers with used gloves. Changing gloves immediately after use protects the client from contamination by organisms. Cross-contamination is a break-in technique of serious consequence to a severely compromised client. Standing 2 feet from the client, speaking minimally, and wearing long-sleeve shirts are not required in standard interventions for risk of infection. A client with neutropenia has an absolute neutrophil count of 900. What is the client's risk of infection? 1. Normal risk. 2. Moderate risk. 3. High risk. 4. Extremely high risk. The correct answer is 2. A client is at moderate risk when the ANC is less than 1,000. The ANC decreases proportionate to the increased risk for infection. Normal risk for infection is when the ANC is 1,500 or greater. High risk for infection is when the ANC is less than 500. An ANC of 100 or less is life-threatening. A client who had an exploratory laparotomy 3 days ago has a white blood cell differential with a shift to the left. The nurse instructs unlicensed personnel to report which clinical manifestation? 1. Swelling around the incision. 2. Redness around the incision. 3. Elevated temperature. 4. Purulent wound drainage. The correct answer is 3. A shift to the left means that more immature than mature WBCs are at the site of inflammation or infection. Immature WBCs are less effective at phagocytosis and do not produce classic signs of inflammation, such as pus, redness, swelling, or heat. Fever is the only sign. Therefore, it is a significant sign of infection in a client with immature or depressed WBCs. A young adult is diagnosed with infectious mononucleosis. The white blood cell count is 19,000 microliter. The client has a streptococcal throat infection, enlarged spleen, and aching muscles. Which of the following instructions should the nurse include in discharge planning with client? Select all that apply. 1. Stay on bed rest until the temperature is normal. 2. Gargle with warm saline while the throat is irritated. 3. Increase intake of fluids until the infection subsides. 4. Wear a mask if others are present. 5. Avoid contact sports while the spleen is enlarged. The correct answers are 1, 2, 3, and 5. The nurse should teach this client to stay on bed rest as long as there is a fever, gargle with warm saline, and increase oral fluids to prevent dehydration from the elevated temperature. The client with an enlarged spleen should avoid contact sports due to the increased risk of injury due to the enlargement. The client does not need to wear a mask, but should observe hand-washing procedures. A client with disseminated intravascular coagulation develops clinical manifestations of microvascular thrombosis. The nurse should assess the client for 1. Hemoptysis, 2. Focal ischemia, 3. Petechiae, 4. Hematuria. The correct answer is 2. Clinical manifestations of microvascular thrombosis are those that represent a blockage of blood flow and oxygenation to the tissue that results in eventual death of the organ. Examples of microvascular thrombosis include acute respiratory distress syndrome, focal ischemia, superficial gangrene, oliguria, azotemia, cortical necrosis, acute ulceration, delirium, and coma. Hemoptysis, petechiae, and hematuria are signs of hemorrhage. What is the earliest clinical manifestation in a client with acute disseminated intravascular coagulation? 1. Severe shortness of breath. 2. Bleeding without history or cause. 3. Orthopnea. 4. Hematuria. The correct answer is 2. There is no well-defined sequence for acute disseminated intravascular coagulation other than that the client starts bleeding without a history or cause and does not stop bleeding. Later signs may include severe shortness of breath, hypotension, pallor, petechiae, hematoma, orthopnea, hematuria, vision changes, and joint pain. The client's family asks why the client who had a splenectomy has a nasogastric tube. An NG tube is used to 1. Move the stomach away from where the spleen was removed. 2. Irrigate the operative site. 3. Decrease abdominal distension. 4. Assess for the gastric pH as peristalsis returns. The correct answer is 3. A splenectomy may involve manipulation of the upper abdominal organs, such as diaphragm, stomach, liver, spleen, and small intestines. Manipulation of these organs and resulting inflammation lead to a slowed peristalsis. An NG tube is placed to decrease abdominal distension in the immediate postoperative phase. The stomach does not need to be manipulated away from the spleen postoperatively, nor would an NG tube accomplish this. The NG tube drains gastric contents and air in the stomach. It is not on the operative site, and therefore cannot be used to irrigate it. The gastric juices are not checked as an indicator that peristalsis has returned. Instead, bowel sounds are auscultated in all 4 quadrants to indicate the return of peristalsis. A client is scheduled for an elective splenectomy. Immediately before the client goes to surgery, the nurse should determine that the client has 1. Voided completely. 2. Signed consent. 3. Vital signs recorded. 4. Name band on wrist. The correct answer is 3. An elective surgical procedure is scheduled in advance so that all preparations can be completed ahead of time. The vital signs are the final check that must be completed before the client leaves the room, so that continuity of care and assessment is provided for. The first assessment that will be completed in the preoperative holding area or operating room will be the client's vital signs. The client should have emptied the bladder before receiving preoperative medications so that the bladder is empty when it is time for transport into the operating room. The client should have signed consent before the transport time so that if there were any questions or concerns, there was time to meet with the surgeon. Also, the consent form must be signed before any sedative medications are given. The client's name band should be placed as soon as the client arrives in the perioperative setting, and it remains in place through discharge. The nurse is preparing to administer platelets. The nurse should 1. Check the ABO compatibility. 2. Administer the platelets slowly. 3. Gently rotate the bag. 4. Use a whole blood tubing set. The correct answer is 3. The bag containing platelets needs to be gently rotated to prevent clumping. ABO compatibility is not a necessary requirement, but human leukocyte-antigen matching of lymphocytes may be completed to avoid development of anti-human leukocyte-antigen antibodies when multiple platelet transfusions are necessary. Platelets should be administered as fast as can be tolerated by the client to avoid aggregation. Most institutions use tubing, especially for platelets, instead of tubing for blood and blood products. A client has been on long-term prednisone therapy. The nurse should instruct the client to consume a diet high in which of the following? Select all that apply. 1. Carbohydrate. 2. Protein. 3. Trans fat. 4. Potassium. 5. Calcium. 6. Vitamin D. The correct answers are 2, 4, 5, and 6. Adverse effects of prednisone are weight gain, retention of sodium and fluids with hypertension, and Cushingoid features, a low serum albumin level, suppress inflammatory processes with mast symptoms and osteoporosis. A diet high in protein, potassium, calcium, and vitamin D is recommended. Carbohydrate would elevate glucose and further compromise a client's immune status. Trans fat does not counteract the adverse effects of steroids, such as prednisone. The nurse is preparing a teaching plan about increased exercise for a female client who is receiving long-term corticosteroid therapy. What type of exercise is most appropriate for this client? 1. Floor exercises. 2. Stretching. 3. Running. 4. Walking. The correct answer is 4. The best exercise for females who are on long-term corticosteroid therapy is a low-impact, weight-bearing exercise, such as walking or weightlifting. Floor exercises do not provide for weight-bearing. Stretching is appropriate, but does not offer sufficient weight-bearing. Running provides for weight-bearing, but is hard on the joints and may cause bleeding. A client is to be discharged on prednisone. Which of the following statements indicates that the client understands important concepts about the medication therapy? 1. I need to take the medicine in divided doses at morning and bedtime. 2. I am to take 40 milligrams of prednisone for 2 months and then stop. 3. I need to wear or carry identification that I am taking prednisone. 4. Prednisone will give me extra protection from colds and flu. The correct answer is 3. The client needs to wear or carry information containing the name of the drug, dosage, physician and contact information, and emergency instructions because additional corticosteroid drug therapy would be needed during emergency situations. Prednisone should be taken in the morning because it can cause insomnia and because exogenous corticosteroid suppression of the adrenal cortex is less when it is administered in the morning. Prednisone must never be stopped suddenly. It must be tapered off to allow for the adrenal cortex to recover from drug-induced atrophy so that it can resume its function. Prednisone suppresses the immune response and mass infections. It does not provide extra protection against infection. The nurse should assess a client with thrombocytopenia who has developed a hemorrhage for which of the following? 1. Tachycardia. 2. Bradycardia. 3. Decreased PaCO2. 4. Narrowed pulse pressure. The correct answer is 1. The nurse observes tachycardia in the hemorrhaging client because the heart beats faster to compensate for decreased circulating volume and decreased numbers of oxygen-carrying red blood cells. The degree of cardiopulmonary distress and anemia will be related to the amount of hemorrhage that occurred and the period of time over which it occurred. Bradycardia is a late symptom of hemorrhage. It occurs after the client is no longer able to compromise and is debilitating further into shock. If bradycardia is left untreated, the client will die from cardiovascular collapse. Decreased PaCO2 is a late symptom of hemorrhage after transport of oxygen to the tissue has been affected. A narrowed pulse pressure is not an early sign of hemorrhage. A client who is taking acetylsalicylic acid caplets develops prolonged bleeding from a superficial skin injury on the forearm. The nurse should tell the client to do which of the following first? 1. Place the forearm under a running stream of lukewarm water. 2. Pat the injury with a dry washcloth. 3. Wrap the entire forearm from the wrist to the elbow. 4. Apply an ice pack for 20 minutes. The correct answer is 4. Aspirin has an antiplatelet effect, and bleeding time can consequently be prolonged. Intermittent use of ice packs to the site may stop the bleeding. Ice causes blood vessels to vasoconstrict. Use of lukewarm water, patting the injury, and wrapping the entire forearm do not promote vasoconstriction to stop bleeding. The nurse evaluates that the client with a platelet disorder correctly understand how to report signs and symptoms of bleeding when the client makes which of the following statements. 1. Petechiae are large, red skin bruises. 2. Ecchymoses are large, purple skin bruises. 3. Purpura is an open cut on the skin. 4. Abrasions are small pinpoint red dots on the skin. The correct answer is 2. Large, purplish skin lesions caused by hemorrhage are called ecchymoses. Small, flat, red pinpoint lesions are petechiae. Numerous petechiae result in a reddish, bruised appearance called purpura. An abrasion is a wound caused by scraping. A 27-year-old female client with a history of systemic lupus erythematosus was admitted with a severe viral respiratory tract infection and diffuse petechiae. Based on these data, it is most important that the nurse further evaluate the client's recent 1. Quality and quantity of food intake. 2. Type and amount of fluid intake. 3. Weakness, fatigue, and ability to get around. 4. Length and amount of menstrual flow. The correct answer is 4. A recent viral infection in a female client between the ages of 20 and 30 with a history of systemic lupus erythematosus and an insidious onset of diffuse petechiae are hallmarks of idiopathic thrombocytopenic purpura. It is important to ask whether the client's recent menses have been lengthened or are heavier. Determining her ability to clot can help determine her risk of increased bleeding tendency until a platelet count is drawn. Petechiae are not caused by poor nutrition. Because of poor food and fluid intake or weakness and fatigue, the client may have gotten bruises from falling or bumping into things, but not petechiae. The nurse is to administer subcutaneous heparin to an older adult. What facts should the nurse keep in mind when administering this dose? Select all that apply. 1. It should be administered in the anterior area of the iliac crest. 2. The onset is immediate. 3. Use a 27-gauge 5/8-inch needle. 4. Cephalosporin potentiates the effects of heparin. 5. Double-check the dose with another nurse. The correct answers are 1, 3, 4, and 5. Older adults may have little subcutaneous tissue, so the area around the anterior iliac crest is a suitable site for these clients. The nurse should use a 27-gauge 5/8-inch needle. Cephalosporin and penicillin potentiate the effects of heparin. 2 nurses should check the dose because a dose error could cause hemorrhage. The onset of heparin is not immediate when given subcutaneously.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.